So causes of muscular imbalance could either be a strength-length issue, which we just discussed, or it could be, if they got in a car accident, it's going to be more of a length-strength issue. They're in spasm, and they're not really weak on the right side. All I have to do is relieve the spasm, and I bring them back into balance. So some things in the mechanism of injury is that it is really a strength-length issue. Other things, like accidents, can be actually a length-strength issue. Okay? So that's where my neuromuscular comes in. This is just showing you that last phase, which was that orthokinetic dysfunction, is that eventually, like we already talked about, it will affect his lumbar. And he will, if he decides to be a golfer, oh my goodness, that much flexion, he's going to blow a disc. He'll blow a disc in a heartbeat. Because he already has 200 pounds of pressure. The minute you sit in that chair, by the way, and I don't get you out of it, you have 200 pounds of gravity force and pressure going down through L4-5. So if someone sits all day, which is our computer age, they're sitting all day, they're already too much flexion. So we're going to talk about that and how our training is wrecking people. So don't get into the fix-it trap with your clients, is all I'm going to say. What fixes your busy schedule better? Exercising an hour a day or being bed 24? It's up to them to do their corrective exercises. It's up to them to neural activate. Once you know what to give them to go home with, because we can say, oh my God, you've got to have a personal trainer's certification. Well, I can tell you, from being a personal trainer for 30 years, they're just now teaching us this stuff. They're just now coming around and telling us, you know, all of the ways that we've already screwed up people. You know, for the last, you know, how many decades we've been screwing people up. So I want you to know that you know what you know, and it's more than a weekend certification, okay? Certainly I studied a lot longer than that, but anyway. Pain and dysfunction. Here's what I want for a massage therapist. Take that cycle backwards. I know how it happens. I know what happens once pain goes. We studied that until the cows come home. Let's undo it. Let's go first for the restricted movement. If I clear up restricted movement, I clear up muscle shortening, I clear up reduced circulation, I clear up the pressure on the nerves, I clear up pain. And I'll never get to trigger points. Okay, if we keep thinking in the other cycle, and we keep going, oh well, that trigger point goes to the head, or that one goes to down the arm and out the fingertips, and it's not that that's not valuable information, but if you don't look at function and how to reverse the cycle from the movement pattern, then we're just chasing it, just like our clients are, and we're facilitating clients to, you know, chasing their own pain.